that clear? And then you want to put all this thing together before you tie the tourniquet on. You don't want to have the tourniquet on and now you're doing all that I'm doing. That means your tourniquet is going to be there longer than is expected, okay? All right, so I have that. This is what is going to go into the vein. But you see over here, this butterfly has this section which is really, really smooth, and this section which has a grit on it. Okay? If I hold the smooth side, it's the wrong way because my bevel is going to be down. So you always have to make sure you're holding the gray side and your bevel is going to be up. Is that clear? All right. The next thing that I'm going to do, if you take a look over here, this has to come off and there's a thread right there. This is a thread. And the thread on there, your tube holder has the same thread inside here. So this is going to thread on to that. You don't have to go all the way. If you have a little bit click, that's fine. Is that clear? So I have that. I have my tubes that I don't want to block your view. But under normal circumstances, I said that if you are right-handed, your equipment should be where? On the right. Okay, all right. I have that. So I'm going to tie this again. Okay, go for it. Make a face for me. Okay, and this is really, really, really good vein over here. Yeah. Okay, so what I'm going to actually do, people would like to clean the site and let air dry. I will always encourage you to clean and use the gauze to dry because we're trying to save the tourniquet time to be less. Is that clear? Yeah. So what I'm going to do is I have that in a circular motion. Okay, I have that. And then I'm going to use also a gauze, the same circular motion. I'm going to use it to dry. Now I have my needle. How to hold this needle is the key. I cannot hold my needle like this because that is weight. It can pull the needle out. Is that clear? Yeah. I said you can't go in like that because this is what? Weight. So that means I always have to actually what? Hold this. And then look at how I'm holding my needle. I'm not holding my needle like this because I can't see through me. Yeah. I have to be able to hold the needle because if blood goes into this needle, blood should flow up to about here. Is that clear? Yeah. So now I have that. My bevel is facing up. And that is the vein right there. As I stretch this vein and I go through it, that is the blood right there. Yes. And the very moment I saw the blood, what did I do? I stopped. I'm doing 2 tubes. So I'll do my yellow tube first. So at this time, I can ask my patient to what? Relax the fist. Is that clear? As my blood, if you take a look, the blood is really feeling very, very, very what? Slow, because this is a 23 gauge. Is that clear? If it was like 21, this tube is already what? Full. Okay. I'm not going to fill up. About half is fine. I get my next tube.
The tourniquet is still on.
The tourniquet, I'm going to come to that. I'm doing only 2 tubes. If I'm doing 10 tubes, I could have removed my tourniquet the very moment blood actually what? Flow here. I'm still working within 1 minute. So, okay, I'm still working within 1 minute. So at this time, I get enough blood that I want. The first thing I did was what? Remove the tourniquet, remove the tube. Okay, I have this over here. The last thing that I'm going to take is what? The needle. Please, I need you to pay attention as to how I take this needle out. I can leave this needle in there because if you go to the ER and we use the vascular access device, the needle stays in your arm for up to 48 hours. So if this thing is here, no blood is going to rule out until I actually use a vacuum to suck it out. So this is why we say needle doesn't draw blood. What draw blood is what? The tube. Do I have blood coming out right now? No. Okay. When I was going into the vein, I was holding the tip of the butterfly to insert my needle. If I'm going to go to take this needle out, I cannot go back here to hold this because I can disturb the patient and move the needle to hurt the patient. So to insert the needle and to remove it has to be totally two different things. Is that clear?
Yeah.
Now, I'm going to remove my needle. I have my gauze here ready to go. I'm going to place my gauze here without pressing on it. Is that clear?
Yeah.
And if I'm going to take it out, I'm not going to go back here. I'm going to take it out from the tip end here.
Yeah.
Is that clear?
Yeah.
And as I take this out,
And
then I put pressure and then the patient can now what? Hold it. And this needle that you guys are going to use, if you take a look over here, it has something here that you can push. If I try to lock this, it's not going to lock until I push this. Is that clear? And as I push these two sides, I can lock my needle. Is that clear? I cannot redo it again after I lock it. It's right here. This is what you are pushing. Okay? This is what you're pushing. Is that clear? So I'm going back again. You guys caught a very important point about why I did not remove the tourniquet immediately. I was doing only 2 tubes.
you within the 1 minute?
I was working still within what? The 1 minute. One of the things is that what if I was doing, let's say, 10 or 15 tubes? Then the best thing would have been to immediately what? Remove the tourniquet. So there's two ways you can actually, work with a tourniquet. One, immediately remove it if you are doing more tubes after you puncture your first tube, or remove it on your last tube if you are doing less what? Tubes. Is that clear? Now, the next thing that I'm going to do, all this is going to go to the shafts, so let me put this away. And normally in the lab, what is going to actually happen, by the time that I drew Godfrey's blood, I will have put the pressure there still. All right? I still want you to put the pressure there, even though his blood is not coming, the vein is not completely healed. I will have gone into my system and typed his name and what the doctor wants and everything. So by the time that I'm ready to draw his blood, the labels will have already printed with all his information here. So all that I have to do is to get the labels and label this, but I said remember to always write the name on here before you actually put on what? The computer labels. Because if anything happens, we can remove these labels to find out which name is on there. Then, while I have done this, the next thing that I'm going to do is to make sure everything here is what? Clean up. Then, the last thing I'm going to do will be to come over here, look at the puncture side to make sure that the person has completely what? Clotted. That hemostasis is actually what? Complete. Then what I'm going to do, excuse me, then I'll get a new gauze over here. Put the gauze there, hold this for me. I have my surgical tape right here. And leave this on at least for about 15 minutes, okay? You can let go. Okay, thank you very much. Then, by this time, I have the patient ready to go. Any instructions that you see that the patient, make sure that they don't bend the arm. If you see them with any heavy bag, make sure they carry the bag in the opposite arm for at least the next 1 hour or 2. Is that clear? Now, so Godfrey, thank you. Sit down and let's explain the blood that I drew.